One. All right, so I see we have a number of people joining from the waiting room. Welcome. Thank you for being here for this Pull Up a Seat. Going to get started just in as soon as everyone's filters in. And I see mics connecting, audio connecting. All right, we appreciate you being here. All righty. Dinisha, do you also want me to hit the admit button as I see people in the waiting room?
I'll take care of that.
Okay. All right, welcome. Hi, Vicky. Thank you for being here. All right, so welcome to our Pull Up a Seat. I want to start with the agenda a little bit. My name is Persis Faye, and this is my first time moderating, so bear with me here, but I have attended these before. If you are not currently speaking, go ahead and go on mute just so in case I'm coming through the speaker or there's background noise, it doesn't filter in and disrupt the presentation. You can hit the unmute button if you are coming off for a question or if you'd like to kind of engage in a discussion that's happening. But otherwise, go ahead and do hit that mute button. What we're going to be doing is we're going to start with kind of our welcome and our introduction, and we'll talk about the 5 agreements as we move through the Pull Up a Seat. And then we will talk about our reason why we have these Pull Up a Seats and why it's so important that we conduct these regularly. Then we'll have a presentation from Dr. Rhodes on breast cancer and mental health. And then we're going to open it up to our patient expert stories, which we'll introduce them as we move into the Pull Up a Seat. And then we'd love to kind of open it up, have your feedback, have you engage with the information that you've heard with everyone who is here today speaking. And we'll wrap it up with a way forward takeaway, MICE, and closing remarks. So let's talk about the 5 agreements, how to be in conversation here in a Pull Up a Seat session. So the first thing we ask is that you monitor your airtime and know that we do have a certain amount of time and that everyone here has taken time out of their day to be here in the Pull Up a Seat. So we want to make sure that no one person is taking up too much airtime. We also want you to speak your truth. This is a non-traditional space. This is not a formal space. So this is a safe space. You can speak as you want to here, your raw stories. Nothing has to be filtered. Go ahead and know that, we welcome that here and we want that here. We want you to speak from your own experiences. So what has your experience been in this field of, mental health and breast cancer? What have you gone through? And also lead with curiosity, not judgment. So because, as I mentioned, this is a safe space, we want to make sure that anyone else with their experience or their truth does not feel like they're judged. So when we ask questions, we could, if we're curious about something, we could say, help me understand or tell me more about. But try to avoid statements that would make another person feel judged for their own personal experience. And then again, keep the space safe. So if it's something that you feel would make someone else feel uncomfortable, maybe you want to take that question offline with them, or maybe you want to ask more questions in not a public forum. Just so you may keep them from feeling uncomfortable. But let's say you really want to know what resource they use, but you don't want to ask the question yet here. You can take that offline. You can direct message them in the chat. And then we also have their contact information at the end. So our why do we do this? And we do this for a few reasons. Up here on the screen, education, advocacy, empowerment, and support. Both before, during, and after breast cancer is really important to us. So we hold these sessions so that we normalize these conversations, but also so that we get information out from real patient and real practitioner experiences in the field. And we hope that that moves us toward our ultimate goal of having a diagnosis not kind of ignite fear into someone. So pull up a seats, basically what it is, it's a bi-directional conversation between patient experts and practitioner experts. And we really wanted to bring voices into a non-traditional space because usually these conversations happen in a doctor's office or they happen in a setting where it may not feel like someone can ask questions or share their experiences. And so this is a space that we created where those conversations can happen and individuals can feel empowered to share their experiences, use their voices, and also educate others who come to these sessions or watch the recording afterwards. All right, so we have Dr. Rhodes here today, and she is a licensed and nationally certified professional counselor. She's also, her description is on the screen here. I don't want to read it verbatim. She's also going to speak, but she has many accolades and accomplishments that pushed her through and towards her journey of where she is now. She had a diagnosis in 2022, and because of that diagnosis, went through treatment that was completed in 2022 as well. So she is a survivor now, and she's surviving and she's thriving, and she's here today to speak with us and to speak to the survivorship population. All right, so what I'll do now is I'm going to stop sharing my screen and she's going to present. So let me go ahead. I muted myself instead. I apologize. I'm going to stop sharing my screen. Dr. Rhodes, whenever you're ready, you can share your screen and get started. We appreciate you being here today.
Thank you all so very much. Hi, everyone. Can everyone hear and see me clearly? Thumbs up. Okay. My name is Dr. Chalice Rhodes. I'm a licensed professional counselor, and I'm here to talk with you patient experts, as well as I am a patient expert today about breast cancer, mental health, and Black women health disparities. Resilience arise, discovering your warrior spirit. So who am I, right? We all have multiple identities, and I'm looking forward to hearing who you all are because we are much more than our breast cancer survivorship, right? You know, I'm a mom. I have two sons, my Isaiah and Daniel. They're 15 and 11 years old. I'm an athlete. I love praise and worship. I'm a breast cancer survivor and thriver. I'm an Inspiring Life Together mother, which is a nonprofit organization that helps mothers surviving breast cancer. And with my diagnosis of DCIS in 2022, I decided to empower myself and others by earning a cancer oncology behavioral health specialist specialty. So that's also what I do. So today we are going to discuss the intersection of breast cancer, mental health, and Black women health disparity research. We're going to analyze this research. We're going to apply various models to breast cancer, mental health, and Black women. We're going to discuss the role of stress and apply ways to build resilience. And then we're going to hear from the Tigerlily angel advocates and their experiences. So let's take a look at breast cancer. Some of the statistics. 1 in 8 women will face a breast cancer diagnosis in her lifetime, and the chance that a woman will die from breast cancer is about 1 in 39. Currently, there are more than 3.8 million breast cancer survivors in the United States. Now, Black women, we have a higher chance of developing breast cancer before the age of 40 compared to white women, and we also have the highest death rate. So 1 in 5 women with breast cancer also have triple negative breast cancer, and at every age, Black women are more likely to die from breast cancer than any other race or ethnic group. While we do have a 4% lower incidence rate compared to white women, we do have a 40% higher breast cancer death rate than white women. And there is also a 6 to 8% gap in our 5-year survival between Black and white women for every breast cancer subtype. Now, listen, when we think of mental health, I am a holistic provider, right? I'm a licensed professional counselor. You know, I serve clients in Georgia, Florida, Delaware, New Jersey, and I'm a holistic provider, right? I believe in mind, body, and spirit. So when we're thinking of mental health, we also want to think of our physical health and our spiritual health. Now, listen, spirituality and religiosity are two different things, right? So when we're talking in terms of spirituality, we're talking about our personal relationship with our higher power. Or for me, I would say my personal relationship with God. Religiosity is more of an organized structure in which we may practice our spirituality. So I'm a Christian counselor. I'm a Christian. I practice within a Christian religion. You know, others may practice in other religions. Some people may worship ancestors or talk about their ancestors or feel their ancestors. You know, I know my grandmother, Esther Rhodes, she was a teacher and she was a reverend in her church, and I definitely feel her spirit with me. So when we're talking about mental health, ladies, let's keep in mind our mental health, our physical health, and our spiritual health. Let's take a look at this study. So this was a study of newly diagnosed breast cancer survivors. Common diagnoses in breast cancer survivors are anxiety and depression, and that was prevalent in this study. Also stress and an adjustment disorder. So when we talk in terms of an adjustment disorder, if we have any kind of life-changing event that happens in our life within the next 3 months, we may experience symptoms of anxiety, depression, post-traumatic stress. It's common, it's normal, and we call that an adjustment disorder because it's within the first 90 days. Now, if symptoms are extending beyond the 90-day period, that's when we may start looking at a clinical diagnosis of anxiety, depression, whatever the symptoms are that are present. Now, I do want to say we all go through things, right? So we all experience different symptoms. The thing that makes mental health disorders a clinical diagnosis is really the degree to which it impacts every area of your life. People who are diagnosed with clinical disorders, you know, we see that multiple areas, their social life, their work life, their family life, you know, all of those areas are impacted. Also, there was an increased cost in healthcare in the first year following breast cancer diagnosis. And that makes sense. You ladies are going to share your story. I know for me, in 2017, my mammogram they found something on my mammogram, but they called it a cyst. Now, fast forward 5 years later, thank God for the doctor who said, let's biopsy this because this looks a little suspicious. And sure enough, they biopsied it, right? So as soon as my mammogram, something looked funny, they told me to come back for more mammogram shots. They looked at that. They said something looked suspicious. They immediately scheduled me for a biopsy. I was having a biopsy like a week later. 2 weeks later, I was having a lumpectomy to remove the cancer. And then a month later, I had another mammogram, which was very painful, but they wanted to make sure they removed all of the cancer before my lumpectomy. Before my radiation treatment. And then maybe 5 weeks after my lumpectomy, was it 5? No, maybe 8 weeks after my lumpectomy, I was starting radiation treatment. So I completed 22 radiation treatments. So if we look at that example, we could see how healthcare costs would be increased. Also, some women, you know, in this study here, again, anxiety, depression, suicidal thoughts, actually having thoughts of suicide. And I do want to highlight in our Black community, the suicide rates have risen with Black women 15 to 24. And I know one thing about Tigerlily Foundation is that, you know, you all really support young women. So suicidal thoughts, actually having thoughts of not, and it could be passive suicidal thoughts. Like, you know, an active suicidal thought is actually wanting to kill yourself. But a lot of times people don't talk about passive suicidal thoughts, where people are feeling so depressed and so sad, they just feel like they just don't want to be here. They don't necessarily want to kill themselves, but they just don't want to be here. And some of you ladies may have experienced that, or for some of the people who are joining us. Also, in this study, impairment in neurocognition was found. So having an impaired memory, reduced concentration, having difficulty concentrating, slower times processing information, and reduced executive function. You know, when we think of executive function, that is that center of our brain where we make decisions. So as a result of treatment, you know, you may find that you're having difficulty making decisions or that you're just slower doing things. And of course, we know there's also chemo brain from chemo treatment, and this may explain some of the neurocognitive disorders. Here's an area that a lot of people don't talk about: sexual dysfunction. So sexual dysfunction involving the desire to have sex, the ability to be aroused, lubrication. You know, a lot of times from the breast cancer treatments, the hormonal therapy, it causes vaginal dryness. So women may find that they need to use additional lubricants, or they may find that they're having difficulty having an orgasm. Also, pain with intercourse is another thing that people don't talk about. People may feel pain with intercourse, and sometimes the doctors, if you're sharing this with your doctor, they may prescribe a dilator to kind of help loosen up the vaginal muscles to help with that vaginal pain. Also, body image concerns. As we know, many women in our breast cancer survivorship population, you know, have experienced mastectomy, or even with a lumpectomy, just the scar that may form, or with radiation treatment. You know, it's common for your breast to shrink in size and lift. So your body looks different, and, you know, we may have a hard time adjusting to that. And then infertility is such a huge one. And this one is one that hits very hard, because for young women who are diagnosed with breast cancer, and maybe, you know, their treatment, because of their treatment, the different options may cause infertility. The different medications, the different hormonal therapies may send women into menopause early. And if women have never had the opportunity to have a child, they may feel lost with that. Or women that have had children and wanted to have more children, but now they cannot. So when we're looking at depression in African-American women, my colleague and I, Dr. Bernice Kennedy, and myself, we developed this multifaceted model of depression in African-American women. And it really takes a look at this biopsychosocial spiritual factors, because research has proven, and I'll talk a little bit more about this later, that spirituality is very important to the Black community and to Black women in particular. I don't want to take up too much time on this model, but I do want to highlight this phenomena. If you guys see right here, this psychosocial phenomena of the strong Black woman archetype. Okay, listen, we are strong. We are inherently strong. And I know there's, you know, a lot of language, oh, strong Black, and we feel like we don't want to be strong all the time. But listen, ladies, if we really think about it, and we'll talk about resilience later, we are strong. Think of what you've been through. Think of your journey. Think of all of the treatments. We are strong. We do not always have to be strong. And so the strong Black woman archetype works for and against us, right? So you're successful. You achieve things. You were able to power through your treatments. Maybe you still work. Maybe some of you are mothers and you still took care of children or wives, or you were still active in your community. The strong Black woman archetype, it works for us, but let me tell you how it works against us. When we have a difficult time asking for help and asking for support. You know, we can become so independent. We're so used to doing things on our own. And I know for me in particular, I'm overly independent, you know, not just because I'm a Black woman, but because of my personality characteristics, my childhood experiences, my experiences through life. So asking for help can really be a struggle for us Black women. Another thing is that, let me tell you something that we've discovered with this model. When Black women present to their health professionals, we look fly, ladies. Our healthcare providers are like not even thinking we're depressed. We go to some of these appointments, our hair is laid. Y'all know we don't play about our hair now, right? Look at Shona. I think I didn't pronounce it right. Okay, I'm sorry. All right. We don't play about our hair. And so we go into these medical appointments and we present, hi, how are you? And we're all business. And the healthcare professional, because again, this model is targeted towards healthcare professionals, because what my colleague and I are trying to do is educate healthcare professionals, because healthcare professionals, there are some healthcare professionals that they don't have as much empathy for us. And if we are not presenting as clinically depressed, meaning looking sad, looking down, looking disheveled, and we're walking into doctor's appointments like this, but internally we're really depressed, it might not even target the healthcare professional to ask us about depressive symptoms. But hopefully you guys have noticed when you go for your annual checkups, I love that they have a quick screening now where they actually asked you straight up, are you feeling depressed? Are you feeling anxiety? Are you experiencing any domestic violence? I hope you guys notice that with your providers. I know when I get my annual physical, I have noticed that that has been incorporated. And so I love that. So I wanted to point that out here, and then I'm going to move on. Oh, well, cultural factors, we'll get to that more, the cultural and the spiritual factors within our Black community. Now, listen, when people think of breast cancer survivorship, they rarely think of grief and loss. But the 7 stages of grief and loss apply here, ladies. And these are the 7 stages. The first stage is shock and denial. You know, think of when you first heard the word cancer. I bet 9 times out of 10, almost all of us experience shock. Like, wait, cancer? Wait, what are you talking? Like, I remember when I first heard those words, cancer, it was like, wait, cancer, you know? And then denial. You may also go through a stage where you're kind of denying it, like, no, this can't be cancer. Like, I know I specifically went through a stage where my doctor was telling me my treatment options. And of course, I'm a researcher, I'm a professor, I'm a therapist. So I went and researched my diagnosis, like I know many of you did. And I started reading studies about some women who were diagnosed with DCIS and they didn't actually need radiation treatment. So I went to my doctor and I said, listen, there's some research studies here. These women didn't need radiation. Can I just get the lumpectomy? I really don't want to have the effects of the radiation. And she said to me, no, because of your type of tumor, radiation treatment is recommended. Okay, because I had a high grade. And then pain and guilt is the next stage of grief and loss. You might actually feel physical pain in your body. You may actually feel emotional pain where you're just hurting, you know, because it's like, oh my God, breast cancer. Now I have to go through this. You may feel guilty. You know, some women may feel guilty because maybe they weren't, you know, keeping up on their mammogram screenings. You know, they recommend age 40 and older to get yearly mammogram screenings, but then that doesn't help target the Black women who get breast cancer at a younger age, right? And who get the more aggressive breast cancer, which is triple negative breast cancer. You know, I remember in 2020, you guys know the COVID-19 pandemic hit, and every April I would get my mammogram, you know, like clockwork. I never missed a year. When I was at one of my appointments, one of the providers said to me, you know, you missed a year in 2020. And I was like, I missed the year of my mammogram. And I remember because that was when the pandemic had just hit, everything was being shut down. Somehow my mammogram appointment was either canceled or either I forgot about it because maybe I had my own COVID-19 anxiety. I know I did go through that like a lot of people did. But, you know, as I was reading and researching, there were so many women that missed their mammograms in 2020 because hospitals were shut down. These areas were shut down. So if you all think, I feel very grateful to be alive because in 2017, if my mammogram found a cyst, they called it a cyst in 2017 on my right breast, and a whole 5 years later, it really did turn out to be breast cancer. And out of those 5 years, I missed my mammogram 1 year. I feel grateful to be alive, as I know many of you do, probably all of you guys do. Now, let's get to the next stage of grief and loss. So the first stage is shock and denial. Second stage is pain and guilt. Next, we have anger and bargaining. I want you ladies to share with me, did anybody feel angry? I was like, wait, okay, yes. I felt angry, y'all. I was like, wait a minute. I have this on my agenda. I have this to do next week. I have this plan. Wait, what do you mean, Actually, the day of my lumpectomy, I actually had an event to go to. I was like, oh, I have to get a lumpectomy because I'm going to an event. And my provider's like, oh, you're going to be I'm like, okay. So anger, and then the bargaining aspect is where our relationship with God can come into play, where we start to question God, why me? Why did this happen to me? And I know I went through that stage. And I said, wait a minute, God, I know you always use me to turn my pain into purpose. So how can I turn my pain into purpose from this event? When I first met with my breast cancer surgeon, we're talking and we're hitting it off, and she was so cool. I felt so comfortable with her. She looks at me and says, wait a minute, what do you do for a living? And she's looking at me, and I was like, oh, I'm a therapist. She was like, we need you. We don't have enough therapists. She said, I don't have therapists to refer my clients to. There really is a mental health shortage of therapists. And so 2 weeks after my surgeon said that to me, ladies, I get an email that says, we would like for people to become cancer oncology behavioral health specialists. And a light bulb went off in my head and in my spirit. And I said, oh God, this is how you want to use this story to empower others. So in honor of Breast Cancer Awareness Month last October, I completed the certificate training program and became a cancer oncology behavioral health specialist. And I said, I'm going to empower myself, help myself, and then I'm going to reach back and help other women. Dinisha has her hand raised.
I'm just clapping for you because that's amazing.
Oh, thank you, Dinisha. Okay, so the anger and the bargaining, and then we have the depression, reflection, and loneliness stage. And I really want you guys to really think about this, because when people talk about grief and loss, they think grief and loss just involves the death of someone. But let's think deeper, ladies. Let's think of the death of whatever it is for you that involved this breast cancer diagnosis. Some people had to stop working. Some people lost parts of their body, their breasts. So grief and loss goes way deeper than just death. And sometimes people can get into depression, or they reflect on how things used to be, or they can feel lonely. I know for me right now, just reflecting on the energy levels I had before I received radiation treatment compared to now, like I had a rude awakening this summer. I'm used to hosting events at my house, and I just rip and run and get up. Well, I've been hosting events, and the next day I'm just out of it. Like, oh my God, where's my energy levels? So, there is this stage, ladies, where we have to go through adjusting to this transition and how our bodies are different as a result of whatever treatment we received, or ongoing treatments that we're still receiving, or future treatments that we may have to receive. But, there is hope, right? Because there's this upward turn stage where out of nowhere, all of a sudden you start noticing, oh, I'm reflecting less on how much energy I used to have. Oh, I'm feeling less sad about it. And now you have this upwards turn stage where you're feeling good. You're starting to get your energy back. Now there's this reconstruction and working through stage, ladies, right? Now we are having to reconstruct our lives after the breast cancer diagnosis, after the treatment. We're having to work through what that looks like. And a final stage of grief and loss is acceptance and hope. Right? Really accepting that, okay, I am a cancer survivor. Wait, I'm strong. I felt very weak a lot of times, but I'm getting my strength back. Wait, I'm a warrior. I went through this, I went through that, and I have hope for my future that I am going to survive. And not only am I going to survive, but I'm going to thrive. Now let's move on to physical health. According to the American Cancer Society, approximately 30% of breast cancers may be preventable with changes in lifestyle. So excessive body weight, physical inactivity, and alcohol intake. Ladies, we need to take a look at this. Physical activity is great for us. And the more that we can shed any excess body weight, the more that we can get active. And listen, start with baby steps. If you have to start with just walking, walk. If you can run. If you like water aerobics like I do, I try to get in the water because it takes, the pain off of my joints, and it makes it easier for me to move in the water. And we all know water is healing anyway. So I love to do water aerobics. Alcohol intake, ladies, we really need to monitor. If you're an alcohol drinker, you do need to monitor, limit your alcohol, and then some people just eliminate alcohol altogether. Also, adhering to the medications that are prescribed, which can be difficult because there could be side effects from the medication that cause nausea, vomiting, and maybe your doctor has to, change your medication. But maybe your medication is necessary. For some women, they have to take a hormonal therapy like tamoxifen for 5 years after receiving treatment. Keeping up with our annual mammograms, and if you have to get an ultrasound. Now, I say ultrasound because dense breasts, that is actually a risk factor for breast cancer. And I was always told that I had dense breasts. nobody really told me that was a risk of breast cancer. But so if you have dense breasts, not your doctor probably, hopefully your doctor prescribes not only a mammogram, but an ultrasound. So before they even confirmed that I had breast cancer, it was years ago. And I bet it was around the time when they said I had that cyst on my breast, I started having to get ultrasounds with my mammograms. And then some doctors recommend MRI, which is something I learned new just from getting my annual mammogram. So I actually had my first mammogram a month ago after treatment. And ladies, I am, and which I know you guys have this story or you're excited to share this, I am cancer free. My mammogram and my ultrasound came back clear. But sometimes there also may be an MRI that your doctor may order if they want to take a look at the tumors or if they see things in your breast. Let's talk about genetic testing. It's really so important. And what I want to say about genetic testing is, I never heard of anybody having breast cancer in my family. And I got to be honest, ladies, I never thought to ask. I never thought to ask any of the elders in my family, did anybody have breast cancer? Because nobody ever said they had breast cancer, right? We have to do a better job of sharing our health information in our community. We have to do a better job of sharing when there is history. Now, what is within our control? It's in our control to ask, right? So we're already in this breast cancer survivorship. We're already on this journey, but we can empower our children, right? Or our cousins to ask the family history, because I didn't think I had a breast cancer history, but after I received my diagnosis and started treatment, I spoke to my aunt and my aunt said, oh, we do have breast cancer that runs in our family. Apparently, the breast cancer skipped a generation and landed on me because two of my grandmother, who I mentioned earlier, my grandmother, Esther Rhodes, two of her sisters were breast cancer survivors. They both had mastectomies. And then my grandfather, his sister had breast cancer. So there actually was a huge breast cancer a genetic component on my father's side of the family. So, I have genetic testing. Thank God my genetic testing came back clear. Some of you will find out from genetic testing that you may carry the BRCA1 or the BRCA2 gene, but genetic testing is really important because it can really change the trajectory of your treatment. Another thing that is very important, ladies, is we have to start participating in clinical research trials. I know there's so much stigma around the healthcare system and the racism and the discrimination and the history that Black people have actually faced with the healthcare system, but clinical research trials is actually going to help us help the treatment for the generations to come, because most of the breast cancer research has been completed on older white women, and our biology differs from older white women, and then, Black women have a higher likelihood of getting triple negative breast cancer, and there's currently no treatment for that. We need to participate in clinical research trials so that we can contribute to treatment, being developed for us and finding out how does our biology differ from other races. Now, let's talk about spiritual health. In this study, 40 Black women, 8 focus groups, okay, high levels of spirituality in African-American survivors was prevalent. Collectivism, in the Black community, there's this collective culture where people do things as a family and it's generational. There were higher levels of spirituality associated with collectivism. And in this particular study, married women had higher levels of spirituality versus single women. Now, the study did also find that attitudes about the efficacy of cancer treatment, meaning, will this cancer treatment work? It had no association at all with spirituality. In this next study, 23 Black breast cancer survivors, prayer was used as a coping skill. Ladies, I got to tell you, as a licensed professional counselor, I know the anxiety techniques. When I found out I had cancer, I used the anxiety techniques on myself. But guess what made the difference? My spirituality and my prayer life and other people praying for me and finding a church home. My sons and I finding a church home that resonated with us and getting under that protection really, truly made the difference for me. Also in this study, there was an increased hope through spirituality, and it actually resulted high levels of spirituality actually result in higher levels of psychological well-being for Black women. So it really is a coping skill for many Black women. Also, in this next study, the survivors reported that God enables breast cancer survivorship and works in their everyday life. So this is what I was talking about spirituality being different from religion. This is a perfect example of spirituality. Here, the women are talking about their personal relationship with God and how they feel like God helped them to survive. I know I feel like that. And how God works in their lives every day to keep them alive and surviving and thriving. Also, in this study, the women identified that the healthiest thing about them was that they were strong African-American women. And we need more community-based participatory survivorship interventions that are culturally and spiritually consonant and peer-based, right? So these studies that I presented are qualitative research studies. It really gets the richness and the details of Black women's experiences, which can help us to develop better interventions and interventions that are tailored to Black women. And spirituality definitely needs to be included in that. Let's talk about some Black women health disparities. So while mortality rates for breast cancer have declined, overall, the incidence rates continue to grow. Now, in this study, which was a 2019 study, Black women, it actually raised 2% from the previous research of 40%. Black women were actually 42% more likely to die from this disease. And also in my research, I saw numbers as high as 46% more likely to die from this disease. So incidence rates are increasing. Other areas that play into Black women health disparities is poverty. Living in poverty is not only associated with health disparities in the healthcare system, but also higher rates of mental health disorders. Access to care. Everyone doesn't have access to care. Everyone doesn't have health insurance. Maybe everyone doesn't qualify, or they may be underinsured. Maybe they do have a level of insurance, but their insurance doesn't cover this particular test. And also, Black women tend to be diagnosed at a later stage of diagnosis. We know that early detection is key. And I'm like one of the poster children for early detection, because my breast cancer surgeon said, Chalice, that ductal carcinoma in situ, the breast cancer was inside of my milk duct. When she did the lumpectomy to remove the cancer, she said it almost escaped. It was right there about to escape out of the milk duct. So I feel very grateful, and so early detection is key, getting our annual mammograms, because, the treatments are easier, for ductal carcinoma in situ, lumpectomy and radiation is the line of treatment, right? So I did not undergo chemotherapy. And because my tumor was not hormone positive, they did not prescribe tamoxifen for me to take for 5 years. Okay, so not everyone is prescribed the tamoxifen or other treatments for 5 years after treatment. And like I was saying earlier, so the breast cancer subtypes are different, right? And here they are on this slide right here. But I want to highlight once again, triple negative tumors are high-grade tumors, and they are the most aggressive, right? And the incidence of this subtype in Black women, especially younger Black women, is twice the incidence rate observed in white women. Now, I don't know if many of you have known this, but this is something that I found out in my research. Studies have shown that pregnancy increases the risk of triple negative breast cancer, but it reduces the risk of ER positive, estrogen or progesterone positive breast cancer. However, breastfeeding was found to eliminate the increased risk of triple negative cancer. I breastfed both of my sons. So when I was reading this, I'm like, wow, did I have a protective factor from triple negative cancer because I breastfed both of my sons? Now, what's interesting in this study here, Black women have more children, especially at a younger age. And this study found that they have lower rates of breastfeeding than white women. So researchers are taking a look to see, do these factors account for the racial disparity in breast cancer? Isn't that interesting? All right. And then, like I was saying earlier, there's possible differences in biological properties between Black and white women, right? So that's another reason why we need to participate in more research. There's also a misconception, in the African-American community among some of us of cancer susceptibility. And I want to say in the Black community, because the Black community encompasses African-American women, women from Africa, Caribbean descent women, biracial and multiracial women may identify as Black women. So when we're saying Black women, we're including everybody, even women of Native American descent is also included in this. But there is this misconception of cancer susceptibility because for so long we were fed the message, oh, white women get cancer. White women have higher rates. So Black, and unless you have it in your family, it really wasn't on our radar to think, oh, this could be cancer. Cultural beliefs. Let's talk about cultural beliefs because the healthcare system, medical mistrust, social justice, as we see on this next slide over here, this third slide, a survey from York State Hospitals revealed that physicians have more negative perceptions towards African Americans and people of low or middle socioeconomic status than of whites and people of high socioeconomic status. When we're talking about culture, I also want to talk about the stigma of mental health in the Black culture. Black people, stop it. We have got to do better. Emotions are real. They happen. But Black people have faced slavery, racism, ethnic disparity, trauma, discrimination. As a trauma response, a lot of Black people have numbed their emotions. It's called emotional numbing. So they don't have feelings. Feelings, what is that? There's also a theory, Maslow's hierarchy of needs, right? So what do we need? There's a pyramid. And at the very basic level, as human beings, we have to meet our food needs, shelter, clothing. So many Black people were just trying to survive. They didn't think about emotions. They didn't have time to even consider emotions. Their mothers and fathers didn't ask them about their emotions. Their mothers and fathers could care less. At least that's how they felt, some of them, about their emotions. So why would they care about yours? Emotions don't exist. We got to get to work. We got to pay these bills and have food, shelter, and clothing. We don't have time to talk about emotions. Stop it, Black people. Stop it. I'm a mental health advocate. I'm going to talk about it and I'm going to empower others to talk about it because emotions are real and there's nothing wrong with it at all. Feel your emotions, experience your emotions, let your emotions wash over you, ladies. Let it wash over you like a wave. You want to let your emotions wash over you because you want to feel and experience them. But then like a wave, you want to let it go back out to sea and let it go. When it washes over you, that washing over may be a day. It may be an hour, maybe 5 minutes, a month, 2 months, 3 months, but we don't want it to be too long, 4 months, 5 months, 6 months. Now it starts to weigh us down. But feel your emotions. You're allowed to have your emotions. It's okay. Okay, breast cancer incident rates are higher among Blacks than whites for women under the age of 45. The median age of diagnosis for Black women is 58 years old, but 62 years old for white women. And the median age of breast cancer death rate is 68 years for all races, but for Black women, it's 62 years. And for white women, it's 69 years. So you all can see the disparities. Also, a woman's breast cancer risk is increased if she has a first-degree relative with breast cancer at a young age, or if she has multiple relatives with breast cancer. So I mentioned the BRCA1 and the BRCA2 gene earlier. 1.3% of Black women have the BRCA1 mutations. And breast cancers in women with a harmful BRCA1 mutation are also more likely to be triple negative cancers, which have a poor prognosis than other breast cancers. And again, like I said earlier, there is no line of treatment for triple negative breast cancer. Also, lifestyle and environmental factors such as smoking, alcohol consumption, infectious diseases, and radiation have a profound influence on cancer development. Poor diet and obesity are risk factors. Less fat intake is needed, and we need to eat more fruits, vegetables, and whole grains. African Americans also have hypertension at an earlier age and tend to develop severe high blood pressure, but they are less likely to receive better treatment. Breast cancer tumors among Black women are more likely to be greater than 2 centimeters in diameter, and progesterone and receptor negative, and are more likely to have characteristics of poor differentiation. So again, those triple negative, more aggressive tumors. Scientific evidence suggests that because of the increased risk of stroke, pulmonary embolism, and deep vein thrombosis associated with tamoxifen, which is a popular drug used to prescribe, for 5 years to take, African Americans who already have a higher prevalence of risk factors for these conditions may receive less overall benefit from the tamoxifen. So Black women are saying, wait a minute, why should I take this? I have all of these side effects. Am I going to have less benefit because I have these existing medical conditions? Also, low vitamin D levels, ladies, get your vitamin D levels tested. Advocate for yourself. When you go for your annual, not your annual mammogram, your annual physical, ask your doctor to test your vitamin D levels. Because of the beautiful melanin in our skin, we do not absorb the sun as much. So our vitamin D levels tend to be lower. I read some studies up to 75 to 80% of Black people have low vitamin D. And sure enough, when I was going through this breast cancer treatment, it was time to get my annual physical. They tested my blood, and sure enough, low vitamin D levels. So ladies, I make sure I take my vitamin D tablet every day. So consult your physician, get that tested. Also with Black women, it was found that Black women tend to rely more on self-examination of their breast than going to doctor's appointments or getting mammograms. And as you know, it's recommended that women over the age of 40 get an annual mammogram. There's also a fear of mammogram pain. People hear of their friends saying, oh my God, I got the mammogram and it was so painful. It was so uncomfortable. It really is for some people. Now, I've always experienced it as uncomfortable, but I did actually experience it as painful a month ago when I had to get a mammogram because my lumpectomy bed is still healing. It really was painful, ladies, but we got to overcome that fear. Also, some Black women, they're scared of the results. They're scared if they actually go and do that, they may have cancer. And Black women tend to be less likely to seek surgery. Okay. And here we have the model again. I included it here again to say in our model, Dr. Bernice Kennedy and I, we want to improve health outcomes for Black women. So one thing that I did when I was a professor, I actually trained nursing, counseling, and medical school students in motivational interviewing techniques, training physicians how to actually talk to their patients, how to get more information, how to express empathy, how to highlight the positive, how to ask open-ended questions, and how to summarize. Because ladies, we have to advocate for ourselves. We have to advocate for ourselves. So if your physician isn't asking you open-ended questions, maybe go to your appointment with a list of questions. Now let's talk about stress. And I'm looking at the time because I want to make sure, I'm already over, ladies. Okay. I want to be respectful of everybody's time, but I do want to highlight stress. Prolonged stress in particular is detrimental and contributes to cancer. And if we're looking at stress, people don't talk about the spiritual aspect of stress, but there is a spiritual aspect of stress, and it's spiritual warfare, right? When we're first diagnosed, a spirit of infirmity, a spirit of heaviness, a spirit of fear. I know a spirit of fear attacked me. A spirit of death. So these are also very important. Resilience, adapting well, bouncing back to tragedy, bouncing back from difficult experience. And resilience is not extraordinary. It's actually ordinary, but it involves intentional behaviors, thoughts, and actions that can be learned and developed in anyone. Here's some resilience factors that contribute to building resilience. Caring and supportive relationships, both within and outside the family, love, trust, positive role modeling, encouragement, reassurance to support resilience, making realistic plans and taking steps to execute the plan, having a positive view of yourself and confidence in your strengths and abilities, Communication and problem-solving skills are essential. The capacity to manage strong emotions and impulse control. So I will end there, ladies. You know, there's just a few slides. These are some exercises. Oh, well, let me end with this one, Dinisha. Ways to build resilience. Ladies, look at some ways that we can build resilience. Make high quality reciprocal connections. Avoid seeing crisis as problems that can't be overcome. Accept that change is a part of living. Move toward your goals. Take action. Baby steps count. Those little baby steps add up to the big steps. Okay, look for opportunities for self-discovery. Nurture a positive view of yourself. Keep things in perspective. Maintain a hopeful outlook. And self-care is so important. Self-care goes way beyond manis and petties. Self-care looks like creating and maintaining healthy boundaries. Okay, that's one example. And there's many other examples. Finding balance in your life. So additional considerations is learning from past mistakes, staying flexible, seek social support. Self-help groups, support groups, read books, online resources, mentors, and licensed mental health professionals like myself. Ladies, thank you so much for allowing me to share this presentation. I hope this gave you guys some great information, and I'm looking forward to hearing from you, fellow Pink Sisters.
When things are going bad, there's going to be some good that's going to come from it. Oh, mission got canceled? Good. We can focus on another one.
All right. Thank you to whoever muted. I wasn't sure what that sound was. But thank you so much again. That was so informational. I'm going to share my screen again with the kind of descriptions of our speakers. So we have Maricia Cole, and Maricia had a diagnosis at age 36. And it was confirmed that she did have breast cancer after multiple biopsies. So, you know, she went through her journey, and she's here today to kind of speak on her experiences. We have Cassandra Ducksworth here. Cassandra, she's 39, and she works for the DOT, so the Department of Transportation. She is a thriver of 12 years. Her diagnosis was in 2011 with stage 2 HER2 positive invasive ductal carcinoma. She is thriving and living life to the fullest, and she's also here to kind of give an overview of her story. Persis Smith is here. Persis, I know your name very well. And she is 35, and she was diagnosed with TNBC, which is triple negative breast cancer. Yeah, so her story is, I think it's really powerful as well. Now, we'll let everyone speak on their own journey, but this room is filled with really powerful women, and I've heard some of their stories before, and we did a Twitter chat, and I've heard some of the pieces of their journey, and they have gone through so many things, but they're surviving and they're thriving. So Shoni Brown is here as well. She was diagnosed in 2015, and she continues to fight. And then we have Deeva Crisp, and she's from Detroit, but she's living in St. Louis. That's in Missouri. And she was diagnosed in 2022, and she's an angel advocate. I want to open it up for our speaker stories, but I will leave my screen shared so that you can read their bios as they're speaking.
Maricia, if you would like to go first.
Hi, good morning. I sure will go first. And I wrote some things down so that I won't forget. Thank you, Dr. Rhodes. That presentation was so good, and I learned so much. I felt a lot like you as a boy mom, as an athlete, as a Christian woman. Everything you said resonated with me today. My life also changed, and I found new purpose as an advocate after my breast cancer diagnosis. I was 36, like Percy said. I'm now 39. I had a scab on my left nipple, that didn't heal. I didn't know at the time that that was a breast cancer symptom. At first, also, I had a DCIS diagnosis. However, I think I immediately became an advocate at that time because as I was reading through my information, I did also see something about the cancer being in my lymph nodes. So I was like, how could it be in one place, but it's in another place, and it's not supposed to be in another place if it's DCIS. Anyways, after, more testing, I was diagnosed with stage 2 invasive ductal carcinoma. I was HER2 positive, progesterone positive, ER positive, and then I was estrogen positive and progesterone negative. And then I had the chemo, a double mastectomy, and radiation as well. So after my first visit, though, with my breast surgeon, who was like the leader of my team, after that first visit, she set me up with, she told me, she gave me the resource, told me that I could be set up with a counselor, like immediately. And so, and not only that, also told me that there was an adolescent and young adult support group. And so I'm in Los Angeles, I'm getting treatment at UCLA, and just really thankful to be in the location that I was in, because I grew up in Arkansas. I know when I go back and I talk to a lot of breast cancer patients there, sometimes it's just not the resources. So now my biggest thing in advocacy is to ask for the resource first. Ask your physician if there are any resources for a mental health counselor or support group. And if they just say, no, it's not any, like Dr. Rhodes was saying, because there is somewhat of a shortage, there are also virtual mental health, counselors. There's like Headspace and different avenues like that I do still feel will help you. So that is one of my biggest things. I was so thankful to have the resource. It helped me. And I remember crying so much in the first visit, because I just felt like the relief, and maybe it's the adjustment disorder also that Dr. Rhodes was mentioning, but it gave me such a relief, and she talked to me about, it's not my fault. She talked to me about, or she really just gave me an avenue to vent. And it was just the best thing, I think, to start my treatment, right? This was told to me at the very beginning. So, and recently we had a Twitter chat, and I wanted to make sure that I also gave resources in that Twitter chat to say, we have to get our mental health together in the beginning, because as you continue to go through your breast cancer journey, it could get worse, and so if you start out, I'm so sorry, it makes me emotional, but if you start out with the resources, it definitely helps. My advice also is to do what you can in, as far as economically, maybe if your insurance doesn't cover your visits to your counselor, feed your mind with positive affirmations, with positive songs. Try to take walks. Have your environment as zen as possible. Quietness, being able to just drink water that's infused with lemons or cucumbers, like things that are economical, but they can bring you some peace with this diagnosis. I know for sure that I had this slower processing and the executive function and the memory deficits. I couldn't even think straight to decide. I had the breast cancer in my left breast, but also I had to make a decision. Do I get a double mastectomy, for prevention purposes? And I couldn't even think straight. I was like, no, I just want to get one. But I had family and friends around me that's like, maybe you should really consider getting both. And I did. And then I'm thankful that I did. But also what comes with that is definitely body image issues. I have a huge scar across both of my breasts. But you know what I said? Mind over matter, almost like the toxic positivity that people say. Okay, if you have scars there, it means you're still alive. So take the scars. You can also make other parts of yourself beautiful. Like Dr. Rhodes said, we're going to get our hair done, get your nails done. You know, that is some part of helping yourself to be beautiful in other areas of your body, even if, you know, your breasts are no longer there. So that's what I wanted to say today. I'm so thankful for this forum. We really need this. We need our tribes. And I'm just so thankful, and I don't want to take up any more time, but I thank you guys for this forum.
Thank you so much, Maricia. And please never apologize for crying. This is an open and safe space, like we said. We appreciate your emotions and your vulnerability here. And thank you so much for being here today. Next up, Cassandra Ducksworth.
Good morning, everyone. My name is Cassandra Ducksworth. I'm a 12-year thriver. I actually found my lump on my own. And thank you, Dr. Rhodes, for that presentation. A lot of things you spoke on hit with me. And I know you said one thing, that African-American women are most likely to do their self-breast exam. Well, I was not one of those people. So I kind of found my lump on my own, I guess you could say, by mistake. I will always tell like people my story is kind of like a movie. Like, I started off that week. I had just got off vacation from coming from Essence Fest, and here I am going back to work that morning. And I was just putting on lotion as I usually do, and I felt something hard, and it was strange. So that morning, I kind of text my friend and just telling her about it, and I immediately went to my doctor's office. We had an on-site clinic at my job, so I went there, and she was kind of concerned. So from there, she sent me to a hospital to get the ultrasound and a mammogram, and they both came back inconclusive. And so they wanted to do the biopsy themselves, but she sent me immediately to a breast specialist who did my biopsy. And within a week, I actually had my diagnosis. And I know a lot of times some people don't move as fast. And I think I would like to credit that the doctor at my clinic, at my employer at that time, she was a Black female doctor. So I kind of give credit to her for moving me in that pace in the right direction right away. I did have family history. Both my dad's sisters had breast cancer, but you know how you answer those questions when you go to doctor's visits, but nobody really kind of spoke with me about getting tested earlier for mammograms or anything like that. So at the time of my discovery of my breast cancer, I was stage 2, HER2 positive, and it was internal ductal carcinoma. I had to go through 6 rounds of chemotherapy, and I also had a double mastectomy. So I was doing all this at the time. I found my lump. I was 27. This was all a month, going into a month before my 28th birthday that I made this discovery. So I was very young. So I had a lot of decisions to make. And when I found out, when the breast specialist called me that day to let me know that I had cancer, I was there with my mom. She was at my house on the couch, and I was cooking, and he called me. And it was like, when he told me, you know, that I had cancer, and just saying all these things on the phone about going into a plan of care and everything, it was like I went into a fight or flight mode. So I'm considered like the strong friend. I'm kind of quiet, but like everybody comes to me for help for everything. And like, as well as being the strong person in my family as well. So, and I'm getting emotional, of course. So it was like, I wasn't thinking of myself at the time, but most likely I was thinking about everyone around me, because I'm the one who can handle so much when things come about. And I'm like, these people are gonna freak out. And so my mom was there, she started crying, and I'm like consoling her and trying to keep myself together. I had to tell my friends. So in a sense, during my period of treatment, I grieved and I cried a little, but not as much as I did like after treatment. So during the time of my treatment, it was like I was keeping life as normal as possible. I'm a big football person. So with my college, I went to Jackson State. So me and my friends were still going to games. We were just going, just still doing everything as normal as I could. It was some things I couldn't do. I was going through treatment, and some stuff I had to still stay away from, and people I had to stay away from because everybody was, doing that time, you're at a tailgate or something, people want to hug and embrace you and all that. And I really couldn't engage with everyone like I wanted to, but it was still good to just be in that space and that atmosphere. Still being around friends and people who I hadn't seen in a long time. So I still did all those things. I went through my treatment. I had my double mastectomy a few days before Thanksgiving in 2011. After that, I had my mastectomy and I had reconstruction, and I was on Herceptin for a full year. So after I completed that, I was going through normal routines, getting checkups, getting scans, and as the years progressed, everything was getting less and less. So it was like I was coming away from the care. And as I was coming away from the care, it was like, in my mind, I'm like, my mind just started going with, I guess you could say, anxiety of fear of not having to go to appointments as regular or having to be scanned as regular. And you're like, shouldn't I be doing this? So I began to overthink everything. It's kind of like how you say, how people say when you go to a funeral or you experience death with someone, and the hardest part is after the funeral is over and then people kind of leave, and it was like everyone was thinking I was okay, but inside I was not okay. I was not okay at all. So I had to go through that and struggle and still kind of push through, because I still had goals. I still had things I wanted to do and job changes I was going through because I didn't like my job at the time. So I kind of felt like cancer had me stuck there for a while. So eventually, fast forward to 2018. Yeah, 2018, I was in my 7th year of being a survivor. And I was still under care of my oncologist, getting seen every so often. And so when I told her I got a new job and that I had to move, she was like, I can release you. And I was like, I kind of like freaked out. And she was like, this is like a happy time because you've gone through everything that you're supposed to go through, everything on the chart that and I wish there was some kind of way or barrier that, like, well, there probably is now, but like something that was in place to like a therapy or some kind of session to, like, as you progress and you go along the process of treatment, so that when it's time for stuff like that, when you kind of get released back into the open world, or as she called it, you just start living instead of just being so tied into, I have to go get this scan, I have to go get this and all this. You just start living and trying to live your normal life. And there was nothing in place for me. So I kind of went through having the process at that time of finding a therapist myself. And because, like I said, during the whole process of me going through treatment, I didn't think about therapy then. And then back in 2011, therapy was real taboo still with with African Americans. There were really no spaces like with Tigerlily around or any other organizations I could go to. So I had to just kind of wing it and do stuff on my own. I did my journaling, you know, I got spiritual connected, my relation with God grew, and things like that helped, that I was just coping on my own, figuring it out. So now all these things are in place. So I began to get help by my current job. They have counselors for different things that are free. And so I guess what they call it is kind of like post-traumatic stress I was going through, as to where I was just still holding on to that pain of what I had went through, because I didn't fully get to release all those emotions and anxiety that was going on, because I was thinking like, oh, okay, I'm trying to protect everyone else, when I was just killing myself on the inside. So now, you know, I'm in a whole better space than I was back then. And now, so that's why I'm glad to like work with different organizations and to speak when I can, because like I said, at that time there was nothing around there for me at that time when I was going through. So even some people don't even like to get on big platforms and to engage with people to like tell about their diagnosis, because I have people inbox me all the time, friends or relatives or friends and everything like that. And I feel that is kind of like part of my purpose, is to show how I went through it and how I survived and still thriving and living my life and going through that. Even if it's been 12 years ago, you know, things still come up, emotions still arise, because I still say I'm young. I'm about to be 40 the next week. So 40 is the new 20 to me. So, so I'm still young, and and still have much life to live. And so I just want to just to encourage everyone to, you know, even though to use the tools that are out there. And because at that time I didn't have many options, or I wasn't around anyone who was like kind of, it's to say, motivating me to try and get therapy, because like I said, it was very taboo still back then. Because like, and now I just believe in therapy or any type or form of some kind of, you need someone to talk to, even if it's just, I mean, you don't want to bear everything on your friends, but sometimes they'll be there to help or to assist, but you need some kind of professional there to guide you and lead you on through that.
Thank you, Cassandra.
Thank
That was
you.
amazing.
Yes.
Thank you for
Amazing.
posing that important point about how the strong people need people too. You cannot always be the go-to, and you do need a go-to as well. So thank you for posing that out. It was very important, and thank you for sharing your story with us today. Our next speaker is Paris Smith.
Hello, everyone. My name is Persis Smith. At the age of 35, I was diagnosed with triple negative breast cancer. No family history. I found the lump on my own, and I had a previous history. Probably like 7 years ago, I had a papilloma on that side. And so when I got my initial mammogram, before that, I started feeling a lump. It was probably like the size of a golf ball. And I ignored it for months, probably like 6 months, and I just put it off. And I had another lump that popped up like right above it, and it had like a texture to it. And I was like, I need to go ahead and get checked out. And I remember going to get my mammogram, and I was so nervous and I was so emotional because I didn't know what was going to happen. I didn't know if it was a papilloma. I didn't know if it was cancer. I didn't know what it was. All I know is I got in there, they did the mammogram, and they called me back and they said, we need to do an ultrasound. So they did the ultrasound, and the radiologist came in there, and she was like, hey, do you have a past history of papilloma? And I'm like, yeah. She's like, well, you might want to get a breast surgeon. And in my mind, I'm like, okay, what type of breast surgeon? That it wasn't really like descriptive. They didn't say like, what type of breast surgeon I should get. So, and I knew something was going on.
Walking up there.
So I went ahead and called them and I was like, hey, I need to get a surgeon and I need to figure out what's going on because they're saying I need to have some type of surgery. And so they called me that day and they was like, hey, we have you scheduled with Dr. Carlson. I went with Winship Cancer Center. And they did the biopsy, all that. They did all the testing and did the MRI, all that. And you go through that waiting period where you're trying to figure out what's going on. So I'm at work and I'm stressing, I'm thinking, I'm figuring out like what's going on. Is it cancer? Is it not cancer? And I remember the day I was at work, I'll never forget it. I was at work and I was doing x-rays and I got a phone call from the radiologist. And I remember him calling me and saying, hey, we need to talk to you. And I'm like, okay, what's going on? And so I was on the phone with the radiologist and I went into one of the bays to just talk to him. And he was like, hey, Miss Smith, I hate to inform you, but both tumors came back cancers. And I almost fell to my knees because I was like, what is this? Like, I almost felt like it was a punishment, from God. And I started like going through things in my life. And I'm like, what did I do like to deserve this? And I also went through this phase where I was like, okay, now I know I have cancer. Like, what stage am I in? Like, am I going to die? Like, I went through all these emotional thoughts. And I saw my surgeon that Wednesday. So I got a phone call Friday. I saw my surgeon that Wednesday. And sweetest man in the world. The first thing he said to me when he came in the office and he put his hand on my lap and he said, God is not upset with you and you didn't do anything wrong. And that was just confirmation for me because I felt like I did something wrong to deserve to get, such a cancer. So initially I was diagnosed with invasive ductal carcinoma, stage 2, grade 3. And yet, but they were still waiting on the HER2 receptor to come back. So he was like, we'll let you know what your full diagnosis is. So he was like, but in the meantime, I'm going to go through the fact that you have to, yes, divine intervention for sure. Everything was God set up. Honest to God, like everything was set up by God. And I got there and he went over like going through chemo and all that. And he was like, you're going to lose your hair. He was like, but you're still going to live your life. He's like, don't go home, get in the corner and not live your life. He was like, you're going to live your life. You're going to lose your hair, but it's going to grow back. And this is not going to affect you. So, initially I was very emotional because I was like, having all these emotions, like, what do you do with it? Like, how do you deal with these things? And because I'm such a closed-in person, I don't really talk. I remember going home and talking to my dad, and my dad bawled. That was my first time seeing my dad cry in a long time. And for whatever reason, when I saw that, I just went into fight mode. And so they called me the next day. So I got hit with that. And then they called me probably like a couple of days later. And my advisor, she was like, hey, I hate to inform you. She was like, but it's triple negative breast cancer. And I instantly just broke down because I'm like, God, like, what is going on? And like, I didn't know like what God was doing through me at the time in this diagnosis, but I knew I instantly went into fight mode. And I knew I had to fight and I knew I had a purpose in my life because I also have MS and I've been through not being able to walk, not being able to do, being able to function. So I'm like, if I could deal with that, surely I can fight such a disease as triple negative breast cancer, which is very aggressive. So I went through all my my chemo and all that. But in that, I gained a self-worth. I did a photo shoot after I lost my hair, which was crazy because people were like, why are you doing a photo shoot? You lost your hair. And I'm like, because I just want to empower other women to let them know that despite losing your hair, you're still beautiful. So I did that photo shoot and I felt so empowered. And I shared it on my social media page and I shared it with other blogs because I wanted women to feel like, hey, just because I lost my hair, that doesn't mean that I'm not beautiful. So I came up with this hashtag beautiful cancer. And I kept that all through my treatment. I went through radiation. I had my, right breast mastectomy, lost my breast. And, you go through all these things, you go through all these body changes, and, you deal with all these emotions and the stress and the depression. And I remember being in such a dark place and I didn't really know who to talk to. But my counselor, my social worker actually called me and was like, hey, if you ever need to talk to anybody, call me. So I would call her every time and I'm like, hey, I'm going through it. Like, I'm struggling today. I'm having a hard time. And I thank God for the people at my job because I was able to talk to every last one of them. I was able to have my family. And I encourage anybody going through cancer to have a support system. When I tell you, it carried me through my whole entire journey. Like, without God in them, like, I would have lost my mind because it was so hard going through that. And not on top of that, like even after, because people don't talk about the aftermath of breast cancer. They talk about what you're going through, why are you going through cancer, but they don't talk about the PTSD, the what if it comes back. Like, you have these things sitting in your mind and you're like, what do I do with these things? Because I don't want to think about having a reoccurrence, but there's a chance, hearing these statistics and knowing that you're an African-American woman and you're a higher rate, you can't help but not to think about these things. So I started to talk to one of the ladies at my church, and she would always encourage me, and she would call me daily, nightly. Hey, Paris, how are you doing? She sent me a journal. I was writing every day. I had this devotion that kept me through every single day. Every day I read it. It was something that I needed. And so I encourage people, because everybody has different faiths, but my faith is in God. And those devotions, those inspirational quotes, those scriptures of healing that I spoke over my life, that's what helped me through this journey. And even going through getting my expander taken out, I went through a deep, dark depression again. It was like different things like happened back to back. But I had to know at the end of the day that God had me and that there was a reason and a purpose that I was going through all these things. And I thank God for Tigerlily because that was my go-to to say, okay, this is what I'm meant to do. You have those times where you're like, okay, God, what is it that I'm supposed to do? I knew when I got with Tigerlily, like, this is what I'm supposed to do. I'm supposed to help other women. I'm supposed to empower them. I'm supposed to uplift them and encourage them with my story. So I just encourage anybody out there going through cancer, going through anything, with the cancer treatments and how hard it is, the depression, the anxiety can just make you get in a corner and just ball up. So I just encourage you to talk to somebody. They have so many resources out there. My social worker she's my savior. Like, without her, I wouldn't have got some of these organizations that help pay for some of my therapy, that help pay for some other things that I needed. So use your resources, use what you have through these cancer centers because they're there to help you. And if they're not there to help you, find somebody else that can help you. And so I just encourage everybody, all these beautiful women who've had beautiful stories. And I just encourage you to keep going and keep pressing on because everybody has a purpose. Everybody has a goal that they're trying to reach when it comes to reaching other people with the stories that they have on their own. So that's my story. And I'm glad to be able to share it with you all. And I'm so thankful for this platform. I'm so thankful for Tigerlily for opening up this platform to talk about mental health because it's so important going through this breast cancer. And so thank you guys. And I just will be praying for everyone, for the rest of their journey, that God would just give you strength and that, you have somebody to talk to. Even if it's not a counselor, there's somebody out there that you can talk to. So I love each and every one of you, even though I don't know you, all of you, but thank you guys for letting me share my story. So.
Thank you, Paris. Thank you so much for being here while you're at your job as well and sharing your story with us. all of you ladies. There's so much love in the chat for all of you for being so vulnerable and open with us today. So we really appreciate it. Our next speaker is Shoni Brown, and I would love for her to take the spotlight.
Okay, sorry, I was having trouble unmuting myself. So I'm going to kind of make it a little quicker. So I was diagnosed in 2015. My history is I'm a health and physical education teacher. So for almost 10, 15 years of my life prior to even being diagnosed, I was the one teaching young girls how to do self-breast exams. So I didn't know how to do my own. I'd done my own. And lucky me, I was coming home from a run, physically active, doing all the right things. And I got ready to take off my sports bra. My hand went underneath my armpit. And I did exactly what I'm doing right now. And I paused. And I said to myself, what is this? It was a lump the size of a gumball, like you'd get out of the gumball machine. So I'm at the age of 35. And I said, this is impossible. This is not cancer. Everybody told me if it moves at all, if it hurts, it does all these things, it's not cancer. And I said, yes, it is. A little bit of a backstory. I lost my mom at 22, almost 23. I'm right before my 23rd birthday to pancreatic cancer. So for me, I've already been in this cancer space, and I saw how she got basically not listened to. She went to doctor after doctor, and it was like, just get some Pepsid, just, lose some weight, everything but running any tests to figure out what was going on, to the point where it was, okay, now you have 3 months to live. So I saw all of that. Fast forward to my diagnosis like 13 years later, and that's exactly what I thought I was going to get. And it kind of was, unfortunately. I got the, no, we don't really think this is what it is. Let's kind of wait and see. And I'm like, no, we're not going to wait and see, because I've already been through this, and you're not going to do that to me. I'm not a statistic. I'm not the average person. I've already seen this happen. We're going to see what's going on with Shoni. So it took me about a month to get actually into a GYN, because I was changing insurances, and you just can't go in and say, give me a mammogram. They also refused the mammogram after the GYN gave me the script, because as soon as she felt the lump, she gave me the name of a script for the mammogram, sonogram, and a surgical oncologist. And I said, okay, so you feel what I feel, and we're thinking the same thing. I call for the appointment for the mammo and the sono. The woman on the phone decided to tell me, but you're only 35. I said, well, then you can talk to the lump. Do you want me to transfer you and you have the conversation? Because I've already got the script. It's not your job to tell me that this doesn't exist, or that my age has something to do with it. Because I knew at this point in time, there could be 18-year-olds that have breast cancer, or even younger. So needless to say, went through the process of biopsies, and I was called on the phone at some random time, and by myself, lost my mind, because I just didn't even know what to do. I eventually had to decide if I'm going to get a lumpectomy versus mastectomy. Thank God I chose the mastectomy, because when they went in, there were 6 more tumors that were there that they did not see. So it had literally spread itself like clockwork right around the surface of the breast. So needless to say, I had been advocating for myself without really realizing that's what I was doing, just because I realized what I had been doing for my mom, and then I started doing it for myself. Even when it came down to just the way I was feeling, and just not knowing and not understanding a lot of my appointments, I was by myself. So even when people say, oh, bring somebody with you, have a support team, not always possible. So we have to remember there are some people who are in this by themselves, even though they have family. Family still gets that, they get these blinders on where, one, if you've had, like myself, lost a mother to cancer, the rest of my family was like, oh my God, we don't know what to do with this. So they tuned themselves out, and I had to tune myself in, and I had to just ride on like the strong person and figure it out. Because if I wasn't going to do it, I'd have curled up in a ball. Even though I wanted to curl up in a ball, I wanted my mom to be there to hug me, to hold me, to tell me it was okay. And then I was going to be okay. But that wasn't there. So I had to push on and do it anyway. And I feel like through treatment, surgeries, all the different things as far as my body changing, losing my fertility, they don't talk about that. My doctor really wanted to not even have that conversation, but that was also part of it. I said, I'm not going to even start any of this because I'm still young. I want to have kids. You're not going to take that away from me. So we're going to try and figure this out. So we did. Well, I did, and I refused to start until we did. Went through my treatment, and, you know, I got the comments of, oh, but you still look great and you're still strong. But like I told you, I was a phys ed teacher. I could barely even move my body. How am I doing what I used to do as a profession when I can't do anything? I could barely walk. I walked with a walker for a month and a half, almost 2 months. I just didn't even know what to do with myself. It went from me running to not even being able to walk by myself. And that took away everything that was what I was and who I was to myself. And my doctor's is like, oh, you're going to find the new you. It's not about finding the new me. It's about me getting over the fact that whatever happened, it happened, and I'm still going to move on because, you know, obviously as people, we grow all the time, and cancer just sped that up. It just made me have to figure out things a lot faster than I wanted to. But so that I don't continue and go a lot further over, I think one of the biggest things that we don't talk about is the survivorship. All of those things that we go through are physically happening to us. And then once your doctor says after 6 months or so, bye-bye, even though I didn't get a bye-bye because of other reasons, medical reasons, they kept me around, and I literally stayed in the cancer center for another year longer, where everyone knew my name. I didn't even sign in. They used to just say hello, and it brought tears to my eyes that I was there that long, that they knew who I was without me even saying anything. But it gets to the point where your life is so structured on doctor's appointments, here, there, them telling you where to go, what to do, and then the ball gets dropped. It's like, now we have to move on to somebody else who's in this aggressive treatment, and you are here because you're still my patient, but I can't give you that same attention. So, like, figure it out. And that's exactly what happens. There's no steps in that process of weaning you down. The same way you, for example, you wean a baby off of a breast onto a bottle. There's a progression. You don't just say, "Hey, taking away the nip. You guys, you're grabbing this bottle." That's just not how it happens. Or even when you're thinking about learning to ride a bike, you don't get on it and just ride and go away. That's not how it works. And that's also the way we should think about it. Not to mention, we should also be talking about the fact that there is a lot of loss in this community. And I say that because today's one of my girlfriend's birthday, and she should be here and she's not. And I almost didn't come. And she fought like hell. And there's not been a day. And it hasn't even been a whole year yet that I haven't wanted to pick up the phone and talk to her. Because we motivated each other to want to be those people for someone else, because we didn't have that. We didn't have the guidance. We didn't have the other women in the cancer center that looked like us, that were the same age as us, that dealt with the things that we dealt with. And there needs to be more of that. I felt like, you know, alone on that island. I looked around and I saw not one woman of color at all, let alone Black woman, young. I had people come up to me and say, "Are you waiting for someone?" And I'm like, "No, I'm sorry. I'm here for myself, by myself. Let's go. Come on." And then they got used to it, so they realized it. But we do need to start talking about, even when you have a counselor, or if you don't have a counselor, if you have a social worker, they need to talk about the fact that there is this part of survivorship. It is the guilt. It is the acceptance that you will lose friends. And I've unfortunately lost way too many people. I can't even count on my hand anymore how many friends I've lost in the last 2 years. All Black women, all leaving children behind. And we need to do something more about it. We talk about it a lot, and it's hard. I'm not even a parent, so it even hurts me to know that my friends' kids don't have their mom anymore. But I'm going to cut it there because, you know, you have other people who would like to speak, and I have cried enough.
Thank you, Shoni. Thank you so much for being here, not just speaking on behalf of yourself, but as your friend, as for your friend as well. So we wish her a happy heavenly birthday. Thank you for still finding the strength to be here today. We really, really appreciate you. Everyone in the chat is sending you a bunch of love. So thank you so much. We do appreciate you. Our final speaker today is Deeva Chris. I'd love to welcome her to share her story as well.
Hello, how is everybody? I've been over here a wreck with my pink tissue and my pink fan trying to get all the tears together, which is the reason why I've stayed off camera, because I have been a wreck listening to all of my fellow angel advocates speaking, and also Dr. Rose. So thank you, Dr. Rose, for all of that information. It really hit home for me. And I also want to say, Shoni, I love you. She has been very instrumental in being a support system for me, because I went through breast cancer kind of just pretty much by myself, except for a very, very few people, my partner, my two best friends. I'm just going to keep my story very short, because I am very new to the breast cancer world. I got diagnosed with DCIS in September of 2022. I had went home to Detroit to celebrate my birthday and had my mammogram before I left. And while I was there partying, they told me, "Hey, we think we see something, come back in." And I went back in and got the test, you know, put the boobs through the table and got them the test results. And the crazy part about my journey is that I did not actually get my test results from my doctor. They just put them in my medical chart. I was having another medical procedure, and I went into my doctor to talk to him about it. And he came up to me crying and hugging me and saying, "I'm sorry, you have breast cancer." So I had no idea. So my journey in breast cancer has definitely been a lot difficult. Most because I did not have the support, like I said, from family and friends, except for a select few. And also because of the disparities that I faced going through my journey. from the way that I was told to not knowing that when I had a reconstruction, I also could get implants or whatever. I didn't know about all of the options until I started seeking out the information. And as a Black woman, it really was very disheartening because it made my journey worse. How I ended up getting into finding the Tigerlily Foundation, I was on Instagram, and I guess that just from Instagram listening to me constantly talking about breast cancer, it ended up flashing Tigerlily, one of their commercials, in my stories. And I reached out, ended up connecting with Shoni and Lisa, who are also angel advocates, who have been such an amazing support system to me, and decided that I wanted to be a Tigerlily advocate. And I actually started my first class as after I had surgery, literally the day that I got my breast cut. I got a partial mastectomy with a double reconstruction. And as I was in the hospital, I was in a lot of pain. I still was logging in for my first day of class to become an angel advocate. I just feel so overwhelmed, and I feel so, I'm trying to find the words because I'm such an empath and I'm holding space for all of the women that were before me. I am just overwhelmed with feeling the overwhelming responsibility of sharing my voice, sharing my story, and making sure that people not only hear my story, but also saying, hey, be your own advocate, stick up for yourself. So I am 5 months, post surgery. My cancer is in remission. I have decided not to do chemotherapy and tamoxifen for my own personal reasons. And I've treated it holistically. And so far, it's been amazing. But I just want to say, first and foremost, thank you to my two best friends who are on here, Vicky and Margaret, who have been so wonderful to me in my journey. I also want to say thank you to Tigerlily Foundation and to Shoni and Lisa, who have been great. But to the people who don't have breast cancer, who are on this Zoom with us, please make space in your heart for people who have breast cancer. It is something that never goes away. I work 60 hours a week. I'm back to work, and I literally every day go in the bathroom to cry because I'm still physically hurting and mentally. It's a lot. So please continue to make space, and not just to be nosy, not just to, oh, I just want to know what's going on with you. Please continue to make space for people who are thriving through breast cancer, who are thriving past breast cancer, because even though my story is only 5 months in, or, so many months in, every lady who I've talked to, whether it's years or months, we all have the exhaustion from just being a breast cancer survivor or a breast cancer thriver. So that's it. That's my story. I am trying not to be a wreck. I appreciate this being a safe space. Again, like I said, for me and for every other woman. And like I said, thank you so much to Tigerlily for this opportunity. It has really, really been a blessing to me, and I really appreciate it.
We appreciate you. Thank you so much for being here. I'm just going to share my screen really quick. I'll also turn on my video. This has been such a difficult conversation for so many people here on both sides, listening and speaking, but it's so appreciated. And I think it's created a sense of community here today. So thank you for sharing. Please follow the Instagrams of our speakers today, our Instagrams. Continue connecting over these topics. If you need someone, we are here as your community, and we are here to advocate for you on your behalf. My mind is, I had some things to say, but I've just been so enmeshed in the stories here today, and it's so difficult to come back from that after, we've been listening to you. So it's just such powerful journeys. So thank you for being here. I just want to remind everyone, if you would like to be on one of our panels and share your story or be part of this conversation, please reach out and let us know. We are planning our sessions for next year, and we will be planning our topics. If you have ideas for topics that you'd like to sit on the panels for or speak on next year, also please let us know. Your voices there are very important. What should we be talking about in these spaces? You know, your contribution there helps us keep these relevant to everyone here. Let's see. In the chat, there's just some thank yous again. And I want to remind everyone that we do also have our Twitter chats you can sign up for. You should be getting an email with possibly the recording and the PowerPoint for this. I think Dinisha is going to send that out. And we are past time, so thank you for those who gave us your time extra. I am going to wrap it up, unless, Dinisha, are there any last words that we need to go over?
Nothing from my side. Just thank you, ladies, for being here today. We appreciate everyone's time and vulnerability, and we look forward to the next conversation.
Thank you, everyone. That was wonderful.
Thank you, everyone. Happy Friday. Thank you so much again for giving us your time this afternoon, and we look forward to seeing you in
Thank
October on our
you.
Thank you.
Have a good one.
Bye. Bye.